KETV investigates concerns about how a new state tool assigns the type of care people with developmental disabilities need.
We talked to a mother who believes the algorithm will be denying necessary care for her child.
KETV News Watch 7's Madison Perales talked with her and took her fears to state officials.
Nebraskans are, we're independent and we take care of each other, and this seems to fly in the face of that.
This is Carol Salber. She's a mother of two.
She really likes the aquarium.
Her oldest child, Dalton, was diagnosed with autism spectrum disorder when he was 2 years old.
He's been receiving services through the state for about 10 years now.
Dalton has been on the developmental disability waiver. She says state funding from DHHS allows him to lead a normal life with support from service providers.
He's pretty involved, and that's what the services help him do, is to stay engaged and give back to the community.
However, she says a new DHHS assessment tool called Interi, implemented last July, changed his level of care.
His funding is potentially set to be cut by approximately 35%.
DHHS uses Interi to evaluate DD waiver users' needs through a variety of questions and documentation of the person's medical history. KETV Investigates asked DHHS for a sit-down interview, but the department declined. In a response to written questions, a spokesperson said Interi follows a cost-to-serve model and places people in similar scoring groups based on cost analysis research.
It could be anywhere from literally one question to a max of 14 questions. That's it. That will determine their level of care and funding.
Salber says when she brought this up to HHS officials, vague responses left her with lingering worries.
To be told that the algorithm decided isn't really comforting to me, and it's not accurate.
When asked about the algorithm's accuracy, a DHHS spokesperson said the agency continues to monitor the output of the Interi assessment to ensure people receive an appropriate determination that is person-centered. Salber says proof of Dalton's needs lie in his daily activities that require the help of an independent provider and community service providers to help him every day.
Without that high level of support and supervision, his safety is really at risk, and his health is at risk as well. And not just as a moral issue and an ethical issue. I think from the state perspective, it's really financially irresponsible.
Salber's family is not the only one.
This is a bigger issue than just Dalton.
He's one of over 600 people who saw a decrease in their funding since last April. That number comes from the latest Interi results report from the state. Families can appeal their decision to the department's internal hearing office. If the decision is not what the family's looking for, they can petition it to district court. The final stop would be the Nebraska Supreme Court.
Everyone that I'm appealing to is an employee of the state of Nebraska.
DHHS says over 400 people appealed their decisions and 2 assessment decisions were reversed, which the agency says is a procedural correction and not a reflection of an overall issue with Interi. It says the number of appeals is out of a total 7,400 initial and renewal assessments.
It costs money, not just for us, but for the state.
When asked how much money DHHS puts towards these cases, the agency says it invests adequate resources to resolve appeal cases. Resources that Salber wants put toward more productive conversations.
My son's more than a data point. We all know money's tight. Let's work this out. But we can't get there if we can't even come to the table to talk about it.
Madison Perales, KETV News Watch 7.
People in the developmental disability community are holding a listening session this Thursday and invited gubernatorial candidates to the table. Democratic candidate Lynn Walls will be there. Governor Jim Pillen declined due to a prior commitment. That meeting starts at 5:30 at the Vessel Network. You can register by scanning the QR code that's on your screen right now and submit the questions you have for the candidates through the registration form.